Hello. Hello. Hello.
Hello everyone, a very warm welcome to all of you to the Nursing Rise platform. I'm Chitra Pani, your batch member, and today I'm here to connect with you people so that I can tell you about today's session. And as I told you earlier, also as I've told about my schedule, also that what all classes will be conducted for under Plan UG. So for today, we have community health nursing top subject and you will be having a discussion about various topics under community health nursing. And I'll be introducing the specific session mentor who will be conducting your upcoming and the current and the upcoming community health nursing session. But before that, let me again tell you that we have started with a plan UG Norset, and whenever I come for with the session, I always tell you that this is a very important plan for you people that we have launched and how beneficial this plan is going to be for you. So under this plan, I've already told you in many sessions of mine, my previous session, that these live sessions which are being lived on YouTube will be free till 15th of February for all the viewers, for all the third year and fourth year BSc nursing students. You can watch them anytime, whenever you want, and gain sufficient knowledge. So yes, for today, we have a community health nursing topic, and the educator who will be taking this session, her name is Miss Manjeet. And let me tell you a brief about Miss Manjeet, and you will get to know her as you attend her current and upcoming community health nursing sessions. So she is specialized in community health nursing, and she is an alumni of All India Institute of Medical Sciences, and she has a keen interest in teaching undergraduate students, and she has a rich experience of teaching undergrad students under her MSc curriculum, and she holds a special interest in community health nursing. And you will get to know once you attend her session that she has a very good command in her subject, and you will get a lot of knowledge after attending her session. So I hope I wish a very warm welcome to Miss Manjeet. Hello, Manjeet.
Uh, good.
Now here from here you can take the lead and conduct the session.
Okay. I hope I'm. There is some issue. Just a second. Can anybody please confirm I'm both visible and audible? Hello.
Yes, Manjit, you're absolutely visible and audible. You can continue with the session. Yeah.
First of all, I would like to extend my thanks to Ms. Chitra for letting me conduct the session, and a very warm welcome to all the students who, despite this chilly winter, are ready to learn community health nursing, apparently considered as a very boring subject. But our goal will be to make it a bit more interesting and see what best we can learn. Okay, so in today's class, before sharing the screen, uh, we'll be discussing two topics. First would be the healthcare delivery system, and the third would be the epidemiological triad and the epidemiological model. So, first, we'll be going with the healthcare delivery system, which is considered to be a little bit boring, and epidemiology is considered to be a little bit technical. So, before I'll share my screen and let me know if the PPT is visible. Hello. Uh,
Hi, Manjeet, you can share the screen. Your screen is visible, but the PPT is not visible
oh,
right now.
okay.
Yeah, so
I
you
was
can
just
share the screen and then it will be much visible.
like, can you please confirm if my screen is visible? Hello, yes, ma'am. Yes, ma'am. Okay, I hope my audio is audible now. Okay, so we'll start the session with our first topic, which I said would be the epidemiological models, right? So before starting the session, whenever we go to the community or whenever we go to the hospital, what first question do we ask to the patients? It is that like which disease do you have, when did it started, what were the contributing factors. So epidemiology is basically collecting all the information which is related to that particular disease. So whenever we are talking about epidemiological model or epidemiological triad, we are trying to understand what are the factors or what are the possible causative agents, what is the possible favorable environment which is causing the disease. So, to begin with, the topic of the day would be the epidemiological triad, theories, and levels of prevention. So, outline we'll be discussing the definition, agent, host, and environment, classification, epidemiological theory, and levels of prevention. So, by the end of the session, you will all be able to define epidemiology, classify the epidemiological triad, explain the theory of epidemiology, and describe the levels of prevention. So, as we discussed, epidemiology is basically the study of what a disease is, right? What is the frequency of disease? What is the distribution of that disease? And epidemiology is considered as a very useful tool of public health. So, it is a tool for public health action to promote and protect the public's health based on science, causal reasoning, and a dose of practical common sense. For example, why a practical common sense? Because common sense is often said to be very uncommon, because you be able to judge that this could be the risk factor for that particular disease or not on the basis of your level of understanding. So, what is epidemiological triad? So, triad means three things, right? So, we will understand it this way. For example, you guys are going to a party, and now if you want to have fun there, what all things do you need? First of all, somebody needs to invite you, right? Then only you will be able to go to a party. So, there need to be a good host. Then the environment should be good of the house. For example, you should have good lighting, good ambience, good colors of the house so that you can enjoy. And now you are an agent, because you are the only one who are going to enjoy the party. If you are not there, then there is no sense of organizing and enjoying the party. So in order to have fun, these three things, agent, host, and environment, need to have a very good interaction so that these three can together cause a disease. So this triad elaborates on how the interaction occurs between an agent, a host, and an environment. Now, the environment makes an interaction between the agent and host. Sometimes students confuse it with epidemiological triangle. Epidemiological triangle is a different thing, and epidemiological triad is a different thing. Do not confuse it with epidemiological triangle. So, when we said that what are the agents of any particular disease, the agents could be biological, the agents could be physical, it could be chemical, or it could be anything related to nutrition, mechanical, and social. The host factors could be the demographic factors, the biological factors, the socio-economical factors, and all the factors related to environment could be the physical, biological, and social. We will discuss them in detail one by one. What are they? So, what is agent? It is an infectious agent causing the disease. It can either be a virus, a bacteria, a parasite, or any other microorganism. Now, the classification is biological, as we said, nutrient, physical, and chemical. So, before moving on to the host, let's do a quick exercise. For example, if somebody is having a disease, tuberculosis, So, what could be the possible biological agent for that particular disease? Yes. Anybody answer, please, in the comment section? The possible biological agent could be mycobacterium. Whenever we talk about malnutrition, so the possible nutritional deficiencies could be vitamin A deficiency or protein deficiency or energy deficiency. So here the agent is the nutritional deficiency. Next is physical. For example, if a worker is working in a factory and all of a sudden there is any occupational hazard and and the person has experienced occupational injury, so here the agent will be the physical environment. Next is chemical. If you any person got a chemical burn from any acid, so here the agent would be chemical in nature. So this classification is made on the basis of what is the nature of that particular disease causing agent. Moving on to host. So now you might say that if my Mycobacterium tuberculosis is there in the environment, then it is supposed to cause TB to everyone. But this is not the case, that everyone does not encounter TB in their life. The reason being the characteristics of the host. It denotes a man who can get the disease. There need to be certain susceptible conditions inside that person to get the disease. So there are various intrinsic factors of the host which are addressed as a risk factors. Now quickly recall and tell me that what age group is affected most by the chicken pox. Yes, younger children are usually affected more from the chickenpox. However, chickenpox is more fatal in adults. So there are certain risk factors, there are certain parameters inside a population which makes it more susceptible to get the disease. Now, this classification could be on demographic features, biological features, socioeconomic features, and lifestyle. So, demographic features, if we talk about, what could be the example? For example, if you are living in a very crowded condition, there is no proper space for ventilation. So now this could be related to the, as I discussed, the ventilation part is not proper and it is very crowded and you are living in a very small room like 10 to 15 people, there are very high chances of getting a communicable disease. So here the lifestyle is playing a very important part in getting the disease. Next is socio-economic features. In earlier times there were certain carcinomas which were considered to be, more prevalent among the lower socioeconomic status, means the people who earn less. Biological features could be, for example, if you have a low immunity or if your genetic makeup is different and if you are genetically more susceptible to a particular disease, then also you can get that. Next is demographic features. Demographic features means certain populations, certain ethnic races are considered to be more susceptible for a particular disease. Next is environment. It is very important for agent and host to interact to develop the disease. So the environment here plays a very crucial role because environment is the one where this host and agent are going to play and they will be seeing that who is going to win. So through the vulnerability of the host extends the invitation to causative agent. It is the environment which favors the interplay between the host and the agent. So now the environment could be divided into two. It could be intrinsic or it could be extrinsic. Intrinsic would be the internal environment and extrinsic would be the external environment. So now moving on to epidemiological theory, but before that, a quick recall. We discussed about epidemiological triad. Epidemiological triad means agent, host, and environment. Agent is the one who is causing the disease. The classification could be demographic, biological, lifestyle, etc. The next is host, the one who is susceptible to have the disease. The example could be the low immunity or certain genetic makeup. The third is the environment. Environment is where there is an interplay of both agent and host, and the reason could be The differentiation could be intrinsic and extrinsic. So we can have one short question during your exams. They might ask that what is an epidemiological triad, explain the elements of epidemiological triad. Or if the examiner is, wants to trick you, he can give you a case scenario. For example, he can give you a case scenario such as this particular bacteria was causing this particular disease in this particular set of population during this particular environment. Now, he might ask you to differentiate which one of the following is agent, which one of the following is host, and which one of the following is environment. You need to be thorough with the three terms. Next is epidemiological theory. So, epidemiological theory states that it is basically a model. Whenever we say that we are discussing a theory, it is somebody has said that this is the certain way which a certain things happen. So, similarly, epidemiological theory is a model which we use to understand the relationships or the causal relationships between environmental factors and the accidents. Accidents here could be injuries, the disease occurring event, or anything. So, the components, what are the components of epidemiological theory? A is predisposition characteristics. Predisposition characteristic is, it is derived from the word predispose. Pre means पहले, dispose means to put at, to discard. कहते हैं dispose कर दिया. So these are the characteristics जो पहले से ही एक इंसान को उस चीज के लिए prone कर रही हैं. So the predisposition characteristics could be susceptibility of people. Certain age group is susceptible to get certain quality of disease. Next is perceptions. Now, when we study community health nursing or when we study the public health, there is one aspect, the sociological aspect of health, which we often, neglect. So, perceptions make a very crucial part of that. Next is environment. Situational characteristics would be risk assessment by individuals, peer pressure, priorities of supervisor, and attitude. Sorry. So, I hope we are clear with epidemiological model, which is predisposition. Just excuse me for a minute, please. I'm so sorry for the interruption. So, where were we? We were at the epidemiological theory. Moving, and then we discussed the predisposition characteristics and situational characteristics. The levels, if we talk about the levels of prevention, there are 4 levels of prevention corresponding to different phases in the development of disease. Now, if we talk about diabetes mellitus, so there are certain risk factors that a person might develop diabetes mellitus later in their life. Okay. Now, if the patient was able to control those risk factors, he might not develop diabetes mellitus. But in case he was not able to control those factors, he will develop diabetes mellitus. Now, there will be a segment where he will be getting the treatment and the diagnosis will be made. If he is able to, follow the treatment, then well and good. But if he is not able to adhere to the treatment, then he might end up in the complication stage. So we saw the different phases in the development of disease. right from the risk factors to the complicated stage. So, based on these different phases, we have designed various levels of prevention, which is usually four levels of prevention. First is primordial, next is primary, then secondary, and then tertiary. So, what is primordial prevention? It refers to the prevention of appearance or developmental of risk factors. Now, you need to consider here that at the first instance only, we are not letting the risk factors develop. For example, obesity is a risk factor to hypertension. Now, during your teenage, you were focusing very much on diet and a very healthy lifestyle. So, you didn't let obesity develop, right? So, you prevented the appearance of a risk factor. So, this is primordial prevention. This is usually achieved with the help of lifestyle modifications and health promotion in countries or population groups in which they have never appeared before. So, this is primordial prevention. Next is primary prevention. So, it helps the client to avoid the expenses, discomforts, and pressure to the quality of life that a disease may cause. Clear? In this, the risk factors have already developed. You have not prevented the risk factors. You were preventing the occurrence of risk factors in primordial. Now, in primary, the risk factors are already there. Now, you are preventing the onset of a disease from those risk factors. Clear? Primordial में हम risk factor ही नहीं आने दे रहे, प्राइमरी में हम रिस्क फैक्टर से डिजीज नहीं आने दे रहे हैं. तो टेक्निकली हम क्या कम कर रहे हैं एक डिजीज का, हम एक डिजीज का इंसिडेंस कम कर रहे हैं. सो आपको याद होगा दैट इंसिडेंस इज यूजुअली डिफाइंड एज द नंबर ऑफ न्यू केसेस. Next is the secondary prevention. So secondary prevention, this focuses on early identification of health problems and prompts intervention to alleviate health problems. पहली स्टेज में हमने रिस्क फैक्टर नहीं आने दिए, सेकंड स्टेज में हमने डिजीज नहीं आने दी, अब थर्ड स्टेज में हम क्या प्रिवेंट कर रहे हैं, हम रिस्क फैक्ट डिजीज हमारे पास हो गई, अब रिस्क फैक्ट डिजीज हमारे पास हो गई है प्राइमरी प्रिवेंशन में, अब हम सेकेंडरी प्रिवेंशन में डिजीज से कॉम्प्लिकेशंस या उसका अर्ली आइडेंटिफिकेशन उस पर फोकस कर रहे हैं. ठीक है, इट फोकसेस ऑन अर्ली आइडेंटिफिकेशन ऑफ हेल्थ प्रॉब्लम्स एंड प्रॉम्प्ट्स इंटरवेंशन टू एलिविएट हेल्थ प्रॉब्लम्स. सो इसमें हम क्या करेंगे, अर्ली डायग्नोसिस करेंगे, ट्रीटमेंट करेंगे, और जब हम ट्रीटमेंट करेंगे तो उस डिजीज की क्या कम होगी, ड्यूरेशन कम होगी. अब ड्यूरेशन कम होगी तो क्या कम होगा, प्रिवेलेंस कम होगा. नेक्स्ट इज टर्शरी प्रिवेंशन. So tertiary prevention focuses on restoration and rehabilitation with the goal of returning the individual to the optimum level of functioning. पहली स्टेज थी जब हमने रिस्क फैक्टर्स प्रिवेंट करने थे, हम वो भी नहीं कर पाए, फिर डिजीज भी हो गई, फिर डिजीज का डायग्नोसिस किया तो उसकी कॉम्प्लिकेशंस भी आ गई. नाउ टर्शरी प्रिवेंशन इज वी आर फोकसिंग ऑन रिस्टोरेशन एंड रिहैबिलिटेशन. For example, if we take the last example of diabetes mellitus, now there is a complication of diabetes mellitus which is gangrene, or there can be gangrene due to diabetes mellitus. So amputation karna pada. Now we are giving rehabilitative devices for mobilization. Yeah, so this would be tertiary prevention. So with this, we come to end of our first session on epidemiological triad, theory, and levels of prevention. But before that, I want to share one thing with you all, that although we have discussed primordial, primary, secondary, and tertiary, there is usually one level of prevention also, which is known as quaternary prevention. Now, what is that? In some cases, whenever a long chronic condition has been diagnosed, there are chances that there will be over medicalization. That person will be imposed with a lot of medical bills, a private treatment. So, in order to reduce that, we go for quaternary prevention. Now we'll be discussing the short and long Q&A. Now the possible questions could be: differentiate between primary prevention and primordial prevention, differentiate between primary prevention and secondary prevention, define epidemiology, not an epidemiological triad, levels of prevention and components of epidemiological triad. With this, in case if any one of you has any form of doubt with these three things which we discussed, which was epidemiology, epidemiological triad, theory, and levels of prevention, please let me know. We'll be waiting for 2 minutes for your queries in the comment section. Okay, so back to our session 2 with more energy. Actually, I would like to apologize that since it's my first class, there are certain glitches and it's all my fault. I completely understand that. And I'll make sure that this doesn't happen in our next class. So now we'll be discussing the healthcare delivery system. But before that, consider yourself, for example, unfortunately, if you're sick in your hostel, what would you do? You would go to a hospital, nearby hospital. Now, why did you go to a hospital? Why didn't you go to a school, or why didn't you go to a police station or a post office? Why? Because you expected that you will get services in a hospital, which you need instead of going into school. So, whenever we are discussing the healthcare system, there are certain things which we need to understand before diving into the technicalities. If you understand those three, four important concepts, you will never get confused. System is usually basically is an input, process, and output. To be said in simple terms, services is the thing which is offered in a system. Clear? Now, why do you need a system? Technically, you need a system to offer healthcare services. For example, after the year end of 4 years, you clear NORCET examination, you are a nursing officer. Now, in order to give your services, in order to provide health care, you need a hospital or a PHC or a CHC, wherever you are posted. It's not that you simply sit on the road and start giving NG feed or start doing NG feed or ventilating patients. You require a particular system for giving your healthcare services. So, in order to give healthcare services in our country, the government of India has designed a well designated healthcare delivery system through which they offer healthcare services through various healthcare professionals. Clear? So, we will be discussing healthcare delivery model, levels of healthcare, health sector, national health program. So at the end of this session, we will be able to understand healthcare delivery model, levels of healthcare, health sector, and a brief about national health program. So whenever we discuss health in India, it is a very major subject. And we have an independent ministry, we have autonomous ministry, the Ministry of Health and Family Welfare, whose responsibility is to deliver healthcare services to the people. And how they are delivering it? Through a well-designed through a well-designed health system. Now, this health system is also organized at various levels. For example, agar in your nearby village, if a person gets a fever, what he or she is going to do? He is going to go to the nearest PHC. He is not going to call Ministry of Health and say that please offer me health services because I'm having fever. So there has been a system in our country whose responsibility is to offer healthcare services. अब गांव के बंदे को बुखार है तो वो सीधा एक बुखार के लिए 400 किलोमीटर या 500 किलोमीटर ट्रेवल करके सिटी में तो नहीं आएगा या एम्स दिल्ली तो नहीं जाएगा या किसी और एम्स में तो नहीं जाएगा. तो डिफरेंट लेवल्स के हिसाब से इट हैज बीन डिवाइडेड, सेंट्रल लेवल, स्टेट लेवल एंड पेरिफेरल लेवल. इफ आई टॉक अबाउट हेल्थ केयर डिलीवरी मॉडल, हमने पिछले सेशन में बात की मॉडल एंड थ्योरीज. सो मॉडल एंड थ्योरीज आर बेसिकली अ सेट जिसमें हम ये बताते हैं कि ये काम कैसे होगा. तो जब हम हेल्थ केयर डिलीवरी मॉडल की बात कर रहे हैं तो वी आर टेलिंग कि हम हेल्थ केयर सर्विसेज कैसे प्रोवाइड करेंगे. इट कंसिस्ट्स ऑफ इनपुट, थ्रूपुट एंड आउटपुट. इनपुट विल बी द हेल्थ प्रॉब्लम्स ऑफ द कम्युनिटी. अब किसी के पास हेल्थ प्रॉब्लम्स ही नहीं होंगी तो कोई हॉस्पिटल क्यों जाएगा? Why will we be needing a healthcare system? So input is the health problems of the community. Throughput means the healthcare services. And output is the changed health status or the improved health status. Now, this output could sometimes be in positive terms and sometimes it could be in negative terms also. पेशेंट गया एक डिजीज के लिए था, वहां जाके पता चला उसको दूसरी भी डायग्नोज हो गई है. क्लियर? सो इट कुड आइदर बी पॉजिटिव और बी नेगेटिव. So I'll repeat it again. Please do not be confused. Whenever we are talking about healthcare system, there are three levels: central, state, and peripheral. Whenever we are talking about healthcare delivery model, it will be input, throughput, and output. And now the third most confusing thing is levels of healthcare. Healthcare कहाँ provide की जा रही है? किस लेवल की हेल्थ केयर आपको मिल रही है? आपको सिर्फ बेसिक सर्विसेज मिल रही थी तो आपने बोल दिया प्राइमरी लेवल. थोड़ी सी ज्यादा एडवांस मिल रही थी तो आपने बोल दिया सेकेंडरी लेवल. बहुत ज्यादा एडवांस मिल रही थी, लेटेस्ट मशीन्स थी, सारे हम हर तरीके की सर्जरी कर सकते थे तो हमने उसके लिए क्या बोल दिया? टर्शरी लेवल हेल्थ केयर. आई एम फोकसिंग ऑन इट अगेन. सिस्टम की बात आई तो सेंट्रल, स्टेट, पेरिफेरल. ठीक है. मॉडल की बात आई तो इनपुट, थ्रूपुट, आउटपुट. और लेवल्स ऑफ हेल्थ केयर की बात आई तो प्राइमरी, सेकेंडरी एंड टर्शरी. प्राइमरी में क्या क्या आएगा? प्राइमरी में वी हैव टू सब सेंटर्स एंड PHCs because these are the most accessible, these are the first point of contact. नेक्स्ट इज द सेकेंडरी. सेकेंडरी में क्या आएंगे? कम्युनिटी हॉस्पिटल्स एंड कम्युनिटी सेंटर्स. In tertiary we have district hospitals, medical colleges and designated super specialty hospitals. क्लियर? जैसे कि सिर्फ कार्डियोलॉजी विंग है, न्यूरोलॉजी विंग है. Now quickly give me an example of all these three, primary, secondary and tertiary, in the comment section below. एग्जाम्पल बताओ प्राइमरी लेवल ऑफ हेल्थ केयर के, सेकेंडरी एंड टर्शरी. Yes, primary would be your nearest sub center or your nearest PHC. Secondary would be your nearest community health center or the तालुक हॉस्पिटल. टर्शरी में क्या आ जाएंगे आपके एम्स जितने भी हैं, या डेडिकेटेड ट्रोमा सेंटर्स फॉर एग्जांपल जो भी हमारे पास होते हैं, या डेडिकेटेड डेडिकेटेड कैंसर वार्ड्स, कैंसर हॉस्पिटल्स जो होते हैं, दीज आर दी ऑल सुपर स्पेशलिटी हॉस्पिटल्स. Next is the levels of healthcare. So, India's healthcare system functions on the socio-economic and political framework of the country. And there are five different types of sector, and however, one is different from the other. If we talk about the public sector means which is provided by the government. Government could be primary health centers, sub centers, hospitals, health insurance schemes such as CGHS, ECIC, and other agencies. Next is the private hospitals. Now, जो इंसान it offers it on a private one to one basis और खुद का कुछ है, like private hospitals है, polyclinics है, nursing homes है, dispensaries है, general practitioners and clinics है. Next is the indigenous system of medicine. So, indigenous system of medicine is Ayur. Now, you need to remember all these things because there is no, you can't change them as per your convenience. कि indigenous system of medicine में क्या नहीं आएगा. Indigenous system में जो चीजें लिखी हैं वही आएंगे. आयुर्वेदा, सिद्धा, यूनानी, टिब्बी and homeopathy. Voluntary health services would be some non governmental organizations or bilateral organizations or multilateral agencies. Last is the national health programs. So these are launched from time to time to prevent, control, and eradicate certain communicable and non communicable disease. And there are various national health programs. Example batao jaldi se. The examples could be the national health programs, the control program for blindness. Clear? Next is the public health sector. As we discussed, public health sector में क्या आएगा? Primary health care आएगी, hospital centers, health insurance schemes, railway hospital and defense services. Means जो भी government public के benefit के लिए अपने खर्चे से हमें provide करा रही है, it comes under the public health sector. The fee would be very nominal, the charges would be very nominal. Yeah. Next is private. Now, imagine a situation that if we only had public health sector in our country, would it be possible for every citizen to go and get themselves treated? No, it would be very hard because we have a huge population. So, private health sector play a very major role in providing the healthcare services. These these are providing these services for payment. You generally pay a very nominal fee whenever you go to a government setting, but whenever you go to a private health sector, there is usually a lot of amount which needs to be paid. Now, as you all must be knowing about the Ayushman Bharat scheme, wherein the private hospital is delivering a government health service, or it is delivering the government health scheme, and it gets payment from the government instead of getting the payment from us. Clear? So, whenever you go to a private hospital and if you have an Ayushman card, you are going to private sector for their services, but the government is paying for your services. Clear? Services का फायदा उठाया हमने, लेकिन पैसा किसने दिया? Government ने. Next is the super specialty hospitals. So super specialty hospitals render patient services having companies health insurance coverage. If you might have noticed, whenever like there are some hospitals which display a banner outside their hospitals जिसमें लिखा होता है कि ESIC के तहत. So now they are offering the company's health insurance coverage and then they are delivering the patient services. Next is the indigenous system of medicine. Apart from allopathy, whatever we are, any system of medicine which we using comes under the indigenous system of medicine. It basically comprises of Ayush. What is the full form of Ayush? It is Ayurveda, Yoga, Naturopathy, Unani, Siddha, and Homeopathy. So, Ayush in National Healthcare Delivery System is provided under the National Rural Health Mission. We need to be thorough with this. And See, there is a thing which we need to understand, that whenever we are discussing these topics and there is some keywords which comes during our class, then you must be able to recall the key facts about Ayush. So अब इसमें पहला क्वेश्चन क्या आ सकता है कि आयुष was launched under which scheme? Clear? और उस स्कीम में क्या क्या कहा गया था, लाइक व्हाट वर द सलाइंट फीचर्स ऑफ दैट स्कीम. नाउ देन अकॉर्डिंग टू नेशनल रूरल हेल्थ मिशन, at every primary health center there has to have a ayush doctor to provide ayush services. There has to have a ayush dispensary. So ayush is usually accepted by the rural community because medications are easily available, safe and economic. And sometimes we are usually using it in our day to day life and we do not even recognize it. For example, in winters, whenever we get cough and cold, so the most common remedy which our mother asks us to do is have a good cup of tea, like with adrak and all these spices. So this is what it is. It is an indigenous system of medicine. We are using ayurveda. Also, whenever allopathic doctors are a little reluctant and are unwilling to work in rural areas, so at that time also Ayush plays a very crucial role. And we need to understand that only single system will not solve the problems of the country. It doesn't go that way, that okay, I will have, if you know you are given in charge to design the health system of the country and you say I will only allow private practice, no public practice, no indigenous system of medicine. Or you say that only I will allow indigenous system of medicine, no private practice and no public practice. So it doesn't work that way. Our healthcare delivery system is a combination of all these, things, like public भी है, private भी है, indigenous भी है, voluntary health agencies भी हैं. There are certain times when we see that there are certain services which are being offered by an NGO, which ideally should have been offered by a public and private, because there are already a huge burden of public and private. Now NGOs play a very important part in that role, and your homework is to find the five leading NGOs which work in the health sector. So this would be your homework for this session. Okay. Now, they contribute to the healthcare services in India, multilateral agencies or organizations, bilateral organizations, non governmental organizations. All these play a major role in prevention of communicable diseases, maternal and child health, environment development, and concern on human rights. Now, last, the fifth healthcare system is national health programs. Now, there are certain programs, for example, leprosy eradication program, in which certain remuneration is given either to ASHA worker or to patient. There are certain programs where remuneration is given to mother, JSY, JSSK. Now, these national health programs has played a very crucial role in evolving the health level of our country, because they focus on dedicated groups. पब्लिक सेक्टर के अंदर तो सारी पॉपुलेशन आ रही है, प्राइवेट सेक्टर के अंदर तो सारी पॉपुलेशन आ रही है, तो एक सर्टेन सेट ऑफ पॉपुलेशन पे फोकस करने के लिए क्या करना है, उस पर्टिकुलर प्रॉब्लम के लिए, उस पर्टिकुलर पॉपुलेशन के लिए हमने एक डेजिग्नेटेड नेशनल हेल्थ प्रोग्राम बनाया. Clear? So these help us in prevention, control, and eradication of certain communicable and non-communicable diseases. They are launched by central and state governments. There are certain programs which are completely funded by central government. There are certain programs which are completely funded by state government, and there are also certain programs जिसमें 60% contribution center का है, 40% state का है. Clear? And these are available for almost all disease of public health concern. You name a disease like randomly and try to check it by yourself that whether do we have a national health program for it. We do have for AIDS, for blindness we have, for TB we have, for communicable diseases we have, for non-communicable diseases we have, for stroke we have. Okay? So almost for all the major public health concerns, we have national health programs. So, with this, we come to the end of our second session, wherein we have discussed about various healthcare delivery systems. We discussed about five health sectors, which is public, private, indigenous system of medicine, voluntary health services, national health programs. We discussed about levels of healthcare. Previous session, we discussed about levels of prevention. In this session, we are discussing about levels of healthcare. So before ending the session, I want you to write down at least five important questions from the session one and five important questions from the session two, so that it's very easier for you to revise during your exams, because you all are going to write subjective exams, and it is very important to get a good grasp of the content so that you can write more during the exam. So the possible questions could be: mention the voluntary health agencies. What is alternative system of medicine? Now, for example, if this question comes in your exam, define alternative system of medicine. Now it depends how much marks does it carry. If it's just carry the 2 marks, then 2 lines would be sufficient. But for example, if indigenous system of medicine comes in 5 marks, now you simply can't write that indigenous system of medicine is Ayush. You need to elaborate each of it. You have to define what is Ayurveda, what is Unani, what is Siddha, what is homeopathy, all of that. Clear? Similarly, whenever levels of healthcare come, if it is coming in 2 marks, then 2 or 3, 4 lines would be sufficient. But if it is coming in 5 lines, you need to elaborate it. Clear? Primary level of healthcare, secondary level of healthcare, tertiary level of healthcare. Primary level में क्या आएगा, फिर secondary में क्या आएगा, फिर tertiary में क्या आएगा. ऑल्सो आप ये भी बता सकते हो कि प्राइमरी लेवल ऑफ हेल्थ केयर में कौन कौन सी सर्विसेज मिलेंगी, सेकेंडरी में कौन सी मिलेंगी, टर्शरी में कौन सी मिलेंगी. फिर तीनों के एग्जाम्पल लिख दिए: एग्जाम्पल्स ऑफ प्राइमरी हेल्थ केयर, सेकेंडरी एग्जाम्पल्स ऑफ सेकेंडरी हेल्थ केयर एंड examples of tertiary healthcare. So you have to understand that what the examiner wants you to answer, like what he or she is expecting. Clear? So, with this, we have come to the end of our second session as well. I would love to answer all your queries in case if you have any. Please feel free to drop your queries in the comment section below. Okay, so since you do not have any queries as of now, if in case if you have, please deliver it to us, and we will be happy to answer in the next session. So with this, we have come to end of the both the sessions. In the first session, we have discussed epidemiological triad, model, and levels of prevention. In second session, we discussed the healthcare delivery system, models of healthcare, levels of healthcare. Clear? I hope you had a good time learning both the sessions. And if there are any suggestions or queries, please let us know. With this, we'll be signing off for today. Thank you and have a good day ahead.